to the drug crisis in America and a practice known as harm reduction. Advocates say the hard truth is simply that many people who abuse drugs likely won't stop. So they try to make drug use safer by offering clean needles and life-saving Narcan. Now Rhode Island is taking harm reduction to a new, some might say, radical level, becoming the first state to offer sanctioned spaces for people to use illegal drugs. ABC's Phil Lipoff reports.
So this is where you keep the supplies?
Yes, absolutely. This is our supply.
On Providence's south side, outreach worker Oz Lugo prepares for another busy day on the front lines of Rhode Island's opioid epidemic. But he's not providing the kind of help you might think.
These are the needles you hand out? These are used.
It's controversial, but Oz says it's working. He and his team are actually helping people administer their illegal drugs, but with clean needles, supplies, and the overdose reversal drug Narcan. It's a practice known as harm reduction, and demand for it has exploded during the pandemic.
You see, we're getting more people, and we're collecting more.
His group, ACO, serves about 240 people, and in June distributed close to 34,000 clean needles.
I think what's happening here is we get a lot of people that exchange for a larger group.
Oz and his colleague Vanessa invited us to make home deliveries with them.
They give us a phone number so that way we can get in contact with them and let them know when we're there, when we're, going by, or when we're leaving and when we get there.
Why is it so important that you guys exist?
As far as like HIV and hepatitis C, those numbers have been dropping, and I think a lot of it has to do within our drug injection users.
At the first stop, we meet a 26-year-old who wants us to call him Sam. He's been using heroin for 8 years. Have you tried before to stop?
I have, and I've been to many sober houses, many programs, courts, the whole 9 yards. I've tried once, quit for a couple weeks, maybe a month. I couldn't kick it. I'm right back on it.
Yeah, but at least
I have clean needles, so I don't potentially get infectious disease.
A hard reality for so many, like Zoe at our second stop. The mother of two, an IV heroin user, tells us she got hepatitis from dirty needles. The 29-year-old comes from a family struggling with addiction.
Knowing at 7 years old what sniffing Percocet was, watching my mom go to rehab at 13 and her not being at my cheerleading competitions. I was a great athlete in high school. This was not the road that everyone expected I was gonna go down.
She says she wants to stop using, but right now, because of her drug use, she isn't able to be with her two young children.
I grew up watching my parents like that, and I don't want them to ever see me like that.
But this work gets a lot of pushback because, as Oz and Vanessa point out, harm reduction isn't primarily about getting people sober. It's about keeping them alive. People like Flocka, a hardcore drug user. How important is this place to you?
Extremely important.
Why?
Because I know that I can get rigs for free. Because if I can't get it for free, I'm not breaking my 20 or my 40 or my dope or my fat or my crack or my coke to get a bag of sets. I will take a set and bleach it and pray to God that I don't get another illness.
So you pass this stuff out to other people on the street?
And me as well.
And you as well? Mm-hmm. Keeping people safe?
Trying.
Research shows harm reduction methods are effective. Needle exchanges alone are associated with a 50% drop in new HIV and hepatitis C cases. And the Biden administration supports harm reduction. The American Rescue Plan provides $30 million to support those services across the country. But Rhode Island is going a step further. Needle exchange programs and handing out clean supplies to those who use drugs so they can do it safely has been going on for decades. We are here in downtown Providence because Rhode Island is getting ready to lead the nation by opening this country's first ever overdose prevention site. In July, Rhode Island passed House Bill 5245, which will establish a 2-year pilot program starting March 2022. This will allow people who inject drugs to bring their substances into a facility with medical staff who monitor for signs of distress and can then intervene. The move comes as drug overdose deaths in America skyrocketed last year. Provisional data from the CDC showing more than 93,000 people died. That's nearly 30% higher than expected. 384 of them here in Rhode Island.
Because of the COVID-19 pandemic, people are isolated, under a ton of stress, and so this is something that provides that support, provides that environment to use more safely and to stay alive.
Hi, welcome.
Celine Means is with an advocacy group for people who use drugs, Rye Cares. He helped design a gallery space simulating an injection site.
I think right off the bat, people will notice when they come in here that it's probably not what they were expecting to see.
Absolutely.
This looks like a doctor's office.
Absolutely, because that's what these sites are like.
Celine takes us over to the space where users would inject their drugs.
At each site, it's going to be cleaned beforehand. There's going to be a place where you can put your sharps and hand sanitizer. The mirror here is so that you can better sort of aim for your arms, as well as the nurses can monitor how somebody's doing.
People say it's enabling. You're going to put a mirror there so someone can aim better? Well, what's the purpose of that?
These substances exist, and it's either they die on the street or they don't die here.
These supervised injection sites have the overwhelming support of state and city leaders in Rhode Island, including the mayor of Providence. But attempts to open these sites across the country have failed in the past. San Francisco, Seattle, New York, Philadelphia have all tried to set them up in recent years with no success.
My district overwhelmingly asked me to vote against it. They felt it's wrong for the government to condone the use of drugs.
Michael Chippendale represents a rural district a few towns over from Providence. He wants to see more focus on breaking the cycle of addiction.
That person with the addiction use disorder is going to absolutely continue to chase that, regardless of whether the site's nearby or the site's not nearby, or whether they were revived with Narcan 4 times in the last month.
But researchers like Brandon Marshall of Brown University's School of Public Health say the benefits of these sites outweigh the perceived shortcomings. He points to the Insight facility in Vancouver, Canada, where there hasn't been a single overdose death on its premises since it opened 18 years ago.
We found that overdose numbers went down by 35% after the facility opened. We found that access to treatment went up. People were less likely to use drugs in public. There was less injection-related litter and discarded syringes, and crime in the area actually went down.
The people who drafted the legislation say they hope they won't have to battle the so-called not in my backyard mentality.
Decisions on where these injection sites will be are largely determined by where the need is. And our hope is once we start showing the success of this, other communities will actually want to bring them into areas where they have problems.
One spot under consideration, near Providence's West End, home to a tent city. This man tells us harm reduction services, specifically access to Narcan, have made all the difference between life and death.
It's very important because otherwise, like, people will be running around grabbing things out of the trash, like just randomly picking leaves up because not everybody has the means to get syringes.
He says he's overdosed at least 4 times. His wife has had to revive him.
I'm grateful, very grateful for Narcan.
She also struggles with addiction.
I've been homeless off now for over 20 years, but now I'm like, it's hard to stay sober, living in the situation I am.
Understood.
You know, it's hard.
Hi, it's Vanessa with the Exchange. I'm outside.
The hope for those committed to harm reduction is to keep users like Zoe, Flocka, Tiffany, and Sam alive, to give them the chance to one day achieve sobriety, if they choose to pursue it.
I hope that if you ever choose to do it again, that it works for you next time.
Oh, next time when I quit, I ain't going back. After this, I'm done.
Phil Lipoff, ABC News, Providence, Rhode Island.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.